I'm Dr. Amiya Prasad. I'm a cosmetic surgeon specializing in oculofacial, cosmetic, and reconstructive surgery with offices in New York City's Upper East Side and Garden City, Long Island. Microfractional CO2 laser technology is a more modern approach to performing the procedure that we used to do with traditional CO2 laser resurfacing. The idea is that we want to treat the common problems such as wrinkles, fine lines, acne scars, sun-related damage, but we want to be able to get the results that we want, which is real results that turn out with smoother skin and improvement, and at the same time minimize the downtime. The candidate for a microfractional CO2 laser technology is someone who has had changes, particularly in the face, related to either sun damage or aging. Lip lines around the mouth, those vertical lines, some people call them smoker's line or lipstick lines. Microfractional CO2 laser has this wonderful effect of stimulating collagen to help create a shallowing or making the acne scars less deep, as well as smoothing over. In essence, it is a way to restore a more youthful skin quality. Up to this point, for many years, there have been a lot of other technologies, whether it's Fraxel or Thermage, that try to deliver to patients the results which would essentially duplicate what you could do with resurfacing technology. And most of the time, these other technologies fell short. They were often required a series of treatments, and very often patients were unhappy. Once microfractional CO2 laser technology came along, and in particular the miXto microfractional CO2 laser, we were able to do all of what people wanted with one treatment, not a series, but with one treatment, and deliver consistently the results. What this company did, lasering and in developing this miXto SX system, is that they created a very unique pattern and a particular technology in delivering that pattern and in a certain amount of depth with a certain amount of energy. Now those are technical terms that the average person doesn't need to know, but essentially when I looked at all the different technologies, I found that I was happiest with the results that I was seeing with the miXto laser technology. I've been using lasers in my practice for about 15 years, and I've seen a lot of lasers come and go, and it took me a long time to make this decision. For approximately 11 years after using CO2 laser, I used the erbium laser for most of my resurfacing needs. And it's only now that I've been impressed enough to switch to this miXto microfractional CO2 laser, and I'm very, very happy with the results that we're able to do for our patients. The level of discomfort is so minimal that general anesthesia, and defining general anesthesia is when a person has a tube and they're on a respirator, we never do that. We usually do this under topical anesthesia. Topical meaning that we spread a little local anesthetic cream on the skin that makes the skin very numb, and then we can do the treatment directly, and the patient just barely feels anything. So it works out very, very well. Occasionally we do give people sedation if they want it. Ultimately we want them to be comfortable. The recovery time is considerably less than any resurfacing procedure I've ever experienced or have ever performed. Usually patients go back to their normal life with makeup in about a week. The microfractional CO2 laser we perform is routinely done with other procedures. For example, if someone is having their eyelid surgery done, whether it's to get rid of bags under the eyes or extra skin over the eyes, and they're not quite ready for a facelift procedure, but they have some wrinkles and some sun damage, well, this is a perfect 1-2 where they get both the eyelid surgery and the microfractional CO2 laser, and it's a very nice transformation of the face that looks wonderful, looks natural. So it can be done with just about every other facial procedure as well as other non-facial procedures. If we are treating a face with a facelift, it's usually because the skin is so loose and the neck is so loose and requires lifting. However, if a person is just starting to have some of those changes, then this is a great way to improve the skin and create the illusion almost of a facelift, or it can be done at the same time as a facelift to then further improve the benefits of the facelift. Or even if someone has already had a facelift and they're not quite ready for another one, then Micro Fractional CO2 Laser technology can have some of the benefits of a facelift, which includes the tightening of the skin and an improvement in the natural balance of the skin with the rest of the face. One of the most common areas that is overlooked are the hands. Very often, particularly for women, the face can be rejuvenated and everything looks great, but then the hands don't match the face. For those brown spots, fine wrinkles, and discolorations of the hand that make a hand look aged, we can treat the hand and rejuvenate the skin of the hand and really get this beautiful combination which looks very, very youthful. It can also be done in other parts of the body, including stretch marks and other areas where there may be a scar or where there's an area of skin irregularity that can be treated. This technology is very versatile. It stimulates collagen, and it depends a lot on the person's skin type, their age, and what their desired outcome. But certainly it can be used in other parts of the body, but a proper evaluation is necessary.